I'm a research associate in the Institute of Cancer Research in a team called Health Informatics, and I'm a statistician.
Currently, I work 4 days a week as a medical statistician for the Royal Marsden. And that then gives me between 1 and 3 days, depending on whether I want a life, to do other things. So I've got an honorary position at the London School of Hygiene, which gives me the opportunity to help students from all over the world. And I also still do some work in ophthalmology, which is kind of where my medical statistics career began. So that's me in a nutshell. I don't have a typical. Mine's very eclectic. I think so. Since COVID, it's been nice because I can work from home more, and for me, that's been beneficial in that it can be very quiet at home, whereas now a lot of the organisations want you hot desking or in a large room, which can be a real pain if you're a statistician who just wants to be able to think quietly. Teaching, sometimes giving lectures, sometimes conferences, helping people design their projects, and occasionally analysing. I don't get so much time for analysing data, but it does still happen at times. That's me. Over to you, Kate.
So for me, it depends loads on where I am in the project that I may be working on at the time. So at the moment, I'm doing quite a lot of writing up of results of a freedom of information request that we made to hospitals across England. In a couple of months, I'll probably spend 3 to 4 days a week doing straight analysis of the data that we've got from the hospitals coming in, and probably less meetings than I've got at the moment and less writing up. So it's a real cycle over a year or even 2 years of whether I'm doing mainly analysis using statistical software, mainly data cleaning, or mainly meetings either pre or post project, if that makes sense to people. So I'm really interested in digital alerting in hospitals. As hospitals move to electronic health records, there's the scope for lots of alerts which can interrupt clinicians working or might just pop up at the bottom of the screen. So a really recent project is trying to find out what number of sepsis digital alerts are in use across NHS hospitals in England, to try and understand how prevalent they are and the sort of algorithms behind them. So there's a lot in the press about artificial intelligence and machine learning in health, and we're trying to find out, well, how many digital alerts are using what you might say a sophisticated statistical approach, and how many are still using paper-based systems which have just been straightforwardly integrated straight into an electronic health record. So yeah, so that's sort of a project that I've done recently, which is really interesting because it's just asking people what they're currently doing. But that's obviously leading into a much more statistics intensive project looking at actual data to do with digital alerts. Katie.
Yeah, we've just opened a clinical trial at the Royal Marsden on people who've had surgery for breast cancer and are now on hormone treatment to try and stop the cancer recurring. And something that's happening throughout oncology at the moment is the ability to detect things in the blood which signal that the cancer may be coming back. And so this particular trial has a surveillance arm to it, and then a blood test that's taken routinely. And then if the blood test is taken and they find what's called this circulating tumour DNA, at that point they'll randomise patients to a new treatment or slightly modify the hormone treatment, because we don't know at that point whether intervening will make a difference. So this trial will find out whether treating on detection of ctDNA makes a difference. And we don't know. What's interesting about the study is it's half of it's being done in the UK and half of it's being done in France. So that's been quite a challenge, making sure that our patient information sheets are brilliant in both languages, and then also managing the slightly different cultures of what's okay to detect, what's okay to capture in the UK, and what's okay to capture routinely in France, and they're not always identical. So it's presented some interesting challenges, I think, that we'll hopefully work around. And then going back to ophthalmology, they're just about to change how they certify patients in Wales. So when your vision reaches a certain level, you can be offered registration as blind or partially sighted, which puts you in touch with social services. In the past, that's been only ever done with a consultant ophthalmologist instigating the process. In Wales, they are in talks currently about letting optometrists, possibly other allied health professionals, help instigate the process, simply to cope with the large numbers that have happened since the COVID pandemic. And then where I step in is just warning them that if they change the system, then their data may do things they're not really anticipating. So they need to think, what we don't want them to do is suddenly think that they've increased blindness in Wales, whereas actually they've just made the system simpler. So that's quite an interesting thing to have a look at.
I think for me, it's taking complex data that looks a bit impenetrable at the beginning and using a variety of statistical approaches to answer some really important questions in health, which then interpreting it for people who work in health. So the whole story from the beginning to the end. I've been really lucky in working directly with clinicians on quality improvement projects where we've looked at data and we've seen what the data shows us, and then they've initiated small changes and we've looked at data again. And some of that is really simple statistics and some of that has to be quite complex statistics. And so it's nice to have that range of tools that you've got to answer questions that sometimes seem simple and sometimes seem complex. And it's not always the complex questions that need the complex statistics. I don't know if Catey would agree with that, but sometimes it's the simplest questions that need the most complex kind of approaches to understand the answer, if that makes any sense. So yeah, it's that whole story for me.
I always wanted to do medical research, so I wanted to do something quite altruistic. I liked maths and data. What most rewards me is if I've done a project and in some way we can see that have benefit outside of the research community into the real world. And so something I did again when I was at Moorfields was we just managed to show the Department of Health that they could change slightly who they were certifying blind without that impacting massively on their money books, and that made a huge difference to people who couldn't see but had lost their sight, not because of something that affected their central vision, but it had wiped out their visual field. So they couldn't navigate, but if you measured them on an eye chart, they looked like they got brilliant vision. So they were just a group of patients who were being left out by the system, and just managing to give them a little bit of data managed to make DH change the rules. And so then you genuinely felt like, my goodness, I've helped somebody. I think sometimes, you get very envious of doctors and paramedics. They help a patient and they see that, and as statisticians sometimes you feel like you're stuck in the back of the office and none of what you do gets seen. But then to know that something that you've done might have helped just one person, I think is incredible, and that's what makes me happier, I have to admit, than high impact publications. But that's
definitely
me.
I was a secondary school sixth form college teacher. I taught sciences, and interestingly my pay began to be linked to the progression of students from GCSE to A level and the scores, and I became interested in how that national data was collected and how they came up with their algorithms to decide whether or not I should get a bonus. It was a very short period in the teaching pay structure, I think, where there was a bonus associated with pay. So I started doing modules with the Open University to understand the statistics behind it, and then I just became more and more interested. So I had a career switch in my mid-30s to statistics, for that underlying reason. So my current, how that's fed into what I'm interested in is I'm really interested in the way we use routine data in public services to either improve services or to judge services, which doesn't always lead to improvement. And that wealth of data that's just sort of sitting there and isn't always used for good or intelligently. And that's been a really interesting, and moving from education to health has been a really interesting transition, because data is used quite differently in the two areas in terms of judgment and performance and things. So yeah, it was very much, I was interested in how can you make this decision about whether this kid should be getting this grade or this grade? What's the statistics behind that? And I didn't have that knowledge, so I went away and got that knowledge.
Yeah, so I liked maths when I was at school. We weren't introduced to statistics until I did my A levels, and I have to admit that I really detested statistics when it was first taught to me. And I thought the teacher was barking mad. So came out of school with quite a negative view of statistics, thinking I wanted to do medicine, went to medical school, and they wouldn't allow me to say that I didn't know. And to me, that fundamentally wasn't the sort of doctor that I would want to be. I would want to be open and honest with patients. So I came out from medical school and had a think, and went in initially doing computing. I changed. So I'm somebody that changed each year, I think, at university. So I started with computing, then I did maths and computing. Finally, I came across computing, operational research and statistics, and then saw statistics being applied to medical data. And suddenly it lit up something that I felt I could have value in. And that really is why I ended up in medical statistics. I still don't know that I'm interested in. It's funny, I come to the RSS sometimes thinking, well, I'm not really a statistician. I like med stats and nothing else. But then you suddenly find yourself thinking differently to other people, and you realize that that's what the other statisticians do. And actually, you suddenly find data that you never thought would be of interest being interesting. So I guess it's there. The interest in data is there. I do remember, so I was probably quite a weird child in Cardiff, and we had a lovely library. And I just remember coming across a book, and I can't remember whether it was Causes of Death or Causes of Suicide, but looking at these tables of data and finding them fascinating. And so there were clearly signals there, but nobody at our school talked about, in our school, if you were clever, you went into law or medicine, and that was it. There were no talks about how else you might get into medical research. There wasn't talks about other things in life. So, yeah, I got there in the end.
I agree, though, because I think if I'd understood that there were statisticians working in experimental design and things when I was 17, 18, that might have been the path I'd taken back then. I went to agricultural college, so I was really interested in experimental science at that point and field study, field block design and all that, but I didn't know it was a career path when I was 17, 18. And I think if I had known, I might well have thought, that's me. But as it happens, just like you, I got there in the end. I really joined the RSS because I was told I should for my career, and that I should go down the grad stat and CStat pathway, and I should have it on my CV. I think Catey might agree with this, but I think I thought it wasn't for me, that the Royal Statistical Society was for a different sort of person and someone who did a different sort of statistics, and not someone who really looked like me or talked like me or had the career path that I'd had. So I did do it. And then since I've joined, I think I've met lots of people who are like me, and who may not be exactly like me, but who are doing maybe the sort of statistics, the sort of work I do. And I've realised that it's a much broader organisation than I thought it was. And the more I take part in it, the more I can see that I'm going to get more and more out of it. But yeah, so firstly, I did it for my CV, but I can see now that maybe I should have done it earlier.
Yeah, so I was a student member of the RSS, and occasionally went to some meetings at the RSS because I used to work at Moorfields, and Moorfields is just up the road from Errol Street, so there was no excuse to not go. I think I was quite intimidated by the RSS, and if I'd been asked to speak at a meeting, I would have been probably terrified because I thought there would be lots of academic, very theoretical statisticians, and I often felt like what I was doing wasn't quite pure from an academic perspective. It was much more real world and applied. Later on, I was invited to a meeting, so I didn't realise it was an RSS meeting. I went along to the meeting and found out it was an applied RSS meeting, and I was just talking about statistics in ophthalmology, and there was an elderly professor in the audience who asked some brilliant questions, and he came up to me afterwards, and I said, your questions were spot on, and he said, oh well, send me an email. And I said, I don't know who you are. And he said, nobody knows who I am. And then he gave me his pen, and I was on the train going back and realised that it was Tony Greenfield, and I thought, I've heard of Tony Greenfield, I'm sure I've heard of Tony Greenfield. So then went and looked him up and discovered he was Professor Tony Greenfield, and he'd been brilliant in medical statistics. He was lovely, and I guess meeting him and realising that you could be a really truly brilliant medical statistician but still speak like a normal human being and understand where passion comes when statistics are being done badly, he was a revelation. And so it was really him that prompted me to reconnect with the RSS. And I kind of wish I'd done it sooner, because I think something that we're not told early on, often as a statistician, we're quite introverted, we're not really outgoing, but there can be huge value in networking, and just meeting other people who do similar jobs. You find you're doing things similarly, you find you've got a similar sense of humour. Silly things like watching Midsummer and guessing the number of deaths that are going to happen in each episode. That was something that I found Tony Greenfield and I did. And so you just find people that are similar, and so yes, huge value. But it is what you make of it. So come along to the meetings, and if it isn't what you want it to be, then change it, because that's the other thing. You can get involved with the sections and you can start making it different if you don't like what it is currently.
I'm on the medical section of the Royal Statistical Society. I feel like, I think I've only been to 2 meetings, so and we haven't yet met in person because of the COVID and lockdown, and we're discussing how to move that forward. So yeah, that's been really interesting. I feel like I'm starting to learn what the RSS does and its outreach and other things, but I do feel like a real beginner, and I think Catey's been doing it for longer, so I'm going to pass over to Catey.
Yes, I have. I'm not sure how much longer. I think a couple of years longer, and it probably has taken me a couple of years to really get my head around how we operate and what we do. So I'm sit on the medical section, and then I'm also an ambassador for the Royal Statistical Society. And I think again, I'd say I'm a slow learner. So with the ambassador scheme, you're taught how to communicate better, which I think has been brilliant, and now means that at least I will talk to journalists about things, whereas previously I might have been quite guarded. Yeah, I think the medical section organises events at the conference, for example, but then they also organise meetings throughout the year. But COVID kind of put a bit of a dampener on everything. And I think we're just beginning to emerge. Not only are we beginning to emerge, I think some people have discovered they quite like not going places. And so it's how we navigate this different community. Some people that very much want to go and see other people, and then others who've got very happy with attending virtually. And not traveling. So it's I think hybrid meetings are probably going to be the way that we go, but they're not necessarily easy to organise or run currently.
Getting to meet new people and like-minded people who care about statistics and want to make it more accessible and interesting and bring people together. That's been really nice. But yeah, I think at the moment that's the key thing, is I'm starting to understand more about what the RSS does, and getting to meet people like Catey, who we work practically in the same organisation, but I didn't know her before I joined the committee. So that's yeah, that's been really interesting, that there could be someone sitting in an office around the corner from you that you didn't know, but you actually link up through the RSS. So that's been really nice.
I completely agree. I got to know people when I was at King's. I got to know people better through the medical section, despite them working in a corridor alongside. It's just having time to actually be with people. I think that's also what's valuable with the conference. You know, you can sit down and have a coffee and just talk to people, and you discover statistics all over the place.
I think networking, but also you kind of it's really easy to focus in on the stats you need to do the job that you're doing, and to stay within that area, and maybe not think about other ways statistics is being used or applied, other questions that are being asked, and methods that are maybe being used in a different way in other fields. So for me, like just reading the journal, seeing the talks that are available, is also really good way of keeping me a statistician and not just someone who's delivering on a project that I'm currently doing. Yeah, so it keeps my statistics brain a bit more wide and a bit more alive and a bit more thinking. I'm not saying that I'm an expert on anything else other than what I'm currently doing, but it just reminds me that there's a lot of other things going on out there, as well as the meeting people. I'm not disagreeing with your comment. I'm more kind of saying that's the other thing I really like. And then I send significance to my dad, who's a retired pure mathematician, when I've read it, and then he reads it, and then we talk about it. So that's also really nice, that it has a wider appeal, and it, you know, I discuss it with my dad.
I suppose the RSS helped me understand the communication challenges I'd had with my father as a child, because I suddenly realised that physics is very deterministic. You know, you follow a model. There isn't any variability in statistics, and so suddenly it dawned on me that our philosophies were fundamentally poles apart. And just understanding suddenly that he just saw the world in a completely different way, and so that was a revelation to me. Yeah, I don't know what he'd have made of Significance magazine. I hate to think. It would have been quite interesting to give him a few copies. I think for me, the other thing, so we talk about networking, but you don't really necessarily know what that means. For me, coming across more experienced statisticians who've worked in a particular area, and then I can ask them a question, and number one, they don't laugh and tell me I'm stupid. Number two, some of the people that I've worked with have got like this encyclopedic knowledge of a reference that helps you, that goes to the nub of the question that you're wanting. And so it's just brilliant working with other people. The other thing, I shouldn't say it really, but coming across some of the elderly statisticians who are now in it because they're genuinely interested in science. They're no longer working for employers and therefore having to follow a party line. Their minds are just free to go wherever they want, and they are an incredible resource. And it's kind of like we need to use them while they're still here. You know, it upsets me that I didn't take David Cox stocks on his offer to go to Oxford. But you know, but that's then taught me a message of cherish the next elderly person that comes along who's got those, not even elderly. I think that's the other thing, working in oncology, you realize just how fragile life can be. And so actually just networking and getting what you can from other people has huge value. And you can sometimes help them. And that's the other thing, that can make you feel better. You know, you might have had a rubbish day at work and feel like you've not really had much value. And then somebody more junior comes along and says, I'm stuck with this problem, and you can help them. And you kind of think, well, I've done nothing but that, but actually that's made my day feel a bit better. So I think it's bi-directional. It's probably more than that, isn't it? It's probably multi-dimensional, but I can't cope with more than 2 dimensions. I had a crisis of confidence post-COVID, where I'd kind of lost love with statistics. And then I read Tim Harford's More or Less book. What's the book? How to Make the World Add Up or something. And there's a quote in there about statistics giving you the truth. And I guess that's kind of what drives me, that sometimes the data tell you something that isn't known, and there's value in that. That was a rather stupid way of answering the question, but
no, not at all.
I think there are inspirational figures to look at, and for me, finding more out about Florence Nightingale was just fascinating. I had no idea, even though I'd been at St Thomas's Medical School, I had no idea that Florence did statistics and that she'd been allowed into the RSS. And then learning more about her life helps you then to troubleshoot some of your own problems. So I think, again, just value in looking. I don't know what else. Have you got anything, Kate?
Yeah, I think I just completely agree, really, that it's what inspires me is that we can unlock answers that I think are quite opaque. Yeah, it's hard, isn't it? It's that data often tells us things that we didn't know, and that data gives people the opportunity to then go in and do other research or other investigations to maybe do some more understanding of how we can improve things or why. But without that understanding of data, I think a lot of what goes on just is anecdotal and is experiential. So I think data, it's inspiring to be able to say, no, we know that this is what's happening, we just don't necessarily know why yet. But I think that is really important, and without people like me and Katie, like, there wouldn't be new drugs, we wouldn't understand what interventions worked, we wouldn't understand what policy changes, what impact they have or what impact they might have on people. And even though each individual one of us is maybe playing quite a small part or a very large part, together I think we play just a hugely important part in health and people's lives. And it is inspiring to be part of that community. And I think the RSS does bring you together with people to remind you that you are part of a community of people making things better. But that sounds a little bit pretentious.
So for me, leaving medical school, you feel like a failure. You feel like you've stepped out, even though you know ultimately it's the right thing for you to be doing. There are questions in your head all the time about, there's also this belief that there's 2 routes, there's the right route and the wrong route. And I guess actually learning that that's a load of nonsense, that there is just a route and you'll get there eventually, I think, until I hit the next disaster in my life, and then I'll be saying something really different. Yes, sorry, that's just, yes, there is value. And I guess that is what I was trying to say to young people, that I think, you know, huge pressure on them to do exams in school. Yes, exams can get you into places. You still get into places without exams. There are other routes of doing things. So it's just determination and grit and finding different ways to get in. So I wouldn't give up.
It's never too late to decide that you enjoy statistics and that's what you want to do. And also statistics, I think, is I think for a lot of people is quite a scary term, and people are scared and think, well, that's not for me. And actually, there's a huge range of people doing statistics and a huge range of what doing statistics means. So just if you enjoy understanding what's happening in an organisation or in a trial or in the world, it may well be that understanding the numbers behind that is going to be your passion, and that is sort of statistics, really. You might be more interested in what's happening at a cellular level, you might be more interested in what's happening at a climate level or a global level, but if what interests you is the graphs and the patterns of data, then you may well be a statistician at heart. So don't think that statistics is only one thing, because I think what your experiences of it at school, at university, and in the press may be really different to what any of us are doing. And we're certainly not doing surveys, which is what a lot of young people end up doing at school, is they go and kind of ask people questions and then they do a bar chart. And some of us are doing surveys, but it's not all. I don't know that school or even your university or the press will give you an idea of what we do on with numbers. But if you like numbers, I think Catey's example of seeing a table and just going, what is that? What's that showing, when she was younger, is really true. If you look at a table and you think, well, is that what it's showing? Why is it doing that? Then at heart, you may well be a statistician. And it is really good fun. Catey talked about, seeing an impact it made. And you might be the sort of person that writes software programs, and then you'll see a paper which used your software program to solve a problem, and that might be a year later, it might be 10 years later, but the impact you have could be further down the line. But lots of people doing statistics will be able to pinpoint something where they've had an impact on people's lives, and that's really exciting too. It's great.